So far, we have discussed a number of factors that contribute to the total and growing cost of healthcare: developing technologies, liability concerns, drug costs, the dwindling supply of primary care providers, and the pressure for profits that come from all directions. We have yet to talk about the single most significant cause.
Why does it cost twice that much in the United States? Why are we spending $7,000 when they're spending $3,500? And of course, they have new medications and high technology and surgery in other countries as well. We have the world's highest paperwork and health administration costs.
Let's say I started an insurance company today, John's Insurance Company. What's going to happen is that the young, healthy people are going to figure out they're paying way too much, and the older, sicker people are going to figure out this is a pretty good deal. So what I have to do as an insurance company is I've got to spend a lot of money figuring out what your risk profile is so I know whether I'm going to cover you or not, which if I don't cover you, it sort of defies the whole purpose of insurance, if you will. I also have to feed a shareholder if it's a public company.
We tend to see a lot of waste in our healthcare system in administrative costs because we allow any kind of insurance and encourage multiple insurance products. That multiplicity of insurance products makes it complicated to decide what's covered and not covered when a hospital or a doctor gives health care. So you have to have software and billing forms for each different insurance company. And then they've got to have people to do the billing. And then the insurance company doesn't want to pay for anything that's not covered, so they reject bills. You have to have staff to go over the bills, and then you have to have staff to correct the bills and send them back. And then you have to have people to fight over the bills.
They're set up to collect premiums, pay out benefits, and make a profit. If you have a patient who's going to be with an insurance company for maybe 2, 3, or 4 years, but then will be changing insurance companies if they change their job, or maybe the job changes insurance companies, that insurance company has no long-term plan for that patient, no long-term involvement for that patient. So they're not being interested really in any preventative care, anything that would prevent the patient from getting sick in the long term. They're only going to be interested in holding down costs for that short period of time the patient's in their system. And they have to make an assumption that patient's probably going to be leaving the system. In addition, they want to keep people out of their system who might be ill or who might have a chance for becoming ill. Because remember, they're set up to collect premiums, pay out benefits, and make a profit. You can't do that if you've selected a population that has a potential for becoming sicker than what you expected. So their job is really not to produce health. Their job is a financial model. I would offer that's a model, along with many other things in healthcare, we have to change.
An estimate of administrative costs that would be avoidable in a simple, regimented, single-payer system. 25% of total healthcare costs is one figure that's used for that.